INMED Partnerships for Children was founded 25 years ago to rescue children from the immediate and irreversible harms of disease, hunger, and malnutrition. Living and working as an archaeologist in southern Mexico and Guatemala, I saw many well-intentioned efforts to deliver medical supplies from the developed world to remote communities. Unfortunately, the results were often ineffective and sometimes caused more harm than good. I once witnessed a shipment of donated medicines arrive in a small village. The dosage instructions were in English, the medicines didn't serve the local needs, and there was no one qualified to distribute them. I found a parent giving her child a hypertension medicine to treat diarrhea. Returning to the U.S., I found many like-minded NGOs and companies that wanted to do a better job of helping families and communities lacking access to basic health care by working together, and that was the start of INMED. INMED's objective is to rescue children from situations that cause physical and emotional harm. For example, saving the life of 5-year-old Rodrigo, who nearly died from a massive infestation of parasites in his belly and lungs. We also ensure that communities are equipped with the knowledge and resources to keep children safe and healthy, and that they have a chance to thrive. Rodrigo was saved, but unless the right preventive measures are in place, another little boy or girl might not be so lucky. To accomplish our goals, INMED works with a worldwide coalition of corporations, foundations, government, and caring individuals to confront specific local needs and develop appropriate solutions. Although the needs are different everywhere we work, the most effective technique is empowering children to become agents of positive change in their own families and communities. In countries where we work worldwide, INMED always prioritizes local staffing so that we fully understand the challenges and solutions that will work in the local community. This cultural sensitivity also allows us to work with communities that fall outside of normal health, education, and social systems because of linguistic and cultural differences and extreme poverty. INMED builds partnerships at all levels to leverage the resources that children, their families, and their communities have to offer. For 10-year-old Miguel, being mentored by a positive role model from his urban California community will leave an indelible mark on his life, one we hope can help him overcome the trauma of witnessing his mother's murder at the hands of his father. Our programs are also designed to encourage participants to share what they learn with others. This multiplier effect maximizes the long-term impact and sustainability of our work. INMED's strength lies in its ability to be flexible and innovative. 25 years ago, we provided impoverished communities with essential medicines because that was the most pressing need at the time. Since then, our programs have evolved to proactively confront emerging challenges in health, nutrition, education, food security, climate change, violence prevention, and community development. We can't simply provide Band-Aid solutions. Urgent needs come first, but we also have to focus on lasting change. I recently visited a subsistence farming family in rural South Africa whose crops were failing and whose children hadn't eaten in 4 days. We could have just provided the family with food and moved on, but they would have been hungry again before long. Instead, INMED is working with them to learn effective, sustainable farming techniques so that they never go a day without food again. INMED's rigorous monitoring and evaluation processes allow us to observe the progress of every program, improve outcomes, and transfer effective approaches to our other programs and communities. We define specific metrics of success for each program and document the impact our work makes on the health, nutrition, safety, educational achievement, economic productivity, and self-sufficiency of our participants. It's the human gains that we value most. In Peru, for example, an independent evaluation of our child survival program documented that our work increased knowledge of life and death health issues from almost non-existent to nearly universal levels among new mothers. And at the same time, it improved the quality of maternal and infant care delivered in remote indigenous communities and strengthened the capacity of the region's healthcare personnel and infrastructure. One of the most commonly misinterpreted aspects of any nonprofit organization, and INMED is no exception, is the whole notion of core operating costs, or what's commonly referred to as overhead. The pressure to maintain minimal operating costs negatively affects the foundation of any nonprofit's work. That's why unrestricted donations are so valuable. They give us the flexibility and strength to better serve the communities where we work, whether that means channeling funds directly into frontline services or strengthening infrastructure to ensure long-term impact. Percentages and dollar amounts don't always tell the full story, so I urge every donor to do their homework, not just as it pertains to an organization's core operating costs, but in understanding the impact created through the programs that these costs support. We've documented so many success stories around the world over the years, but to highlight a few, we've treated millions of children against devastating parasitic infections. We've brought food to tens of thousands of children and their families through school and community and household gardens and other innovative agricultural techniques, and strengthened educational outcomes for hundreds of thousands of children by improving the training of primary school teachers in Latin America and the Caribbean. We've brought working families in Northern Virginia back from the brink of homelessness, helped abused teen moms in South Central Los Angeles learn job skills and make a fresh start, and provided life-saving medical care for women and infants from remote indigenous villages in Peru's Amazon jungle through unique maternity waiting homes, known as Casas de Espera. INMED's always had a very strong corporate foundation and government partner base, but that base is vulnerable to economic conditions, and funding can be cut in the middle of crucial programs. Also, being a very lean organization with nearly everything going into programs, we haven't widely marketed or publicized our work, so the general public doesn't know much about us. But we're trying to make better use of technology to get our story out and involve more individuals as well as institutions. In the most immediate way, additional resources would allow us to expand our programs to meet the needs of more children and their communities. But also, additional resources would help us provide our staff with shared learning opportunities and hands-on training in our other regions, and support vital strategic planning for growth and transferring our successful programs to other areas. We'd like to establish an emergency fund that would allow us to respond to natural disasters or other immediate needs in our project communities. For example, federal budget cuts recently forced a rapid end to our mentoring program for the children of incarcerated parents in Compton, California. This program was so important because it provided a role model and trusted friend who helped them confront their day-to-day challenges as well as long-term dangers like themselves getting involved in gangs and crime. A flexible resource fund would have allowed us to continue the program without interruption. INMED could play a bigger role in ensuring food security for struggling communities around the world through our innovative form of adaptive agriculture that combines fish farming with hydroponics. This system, aquaponics, produces about 10 times as much as traditional agriculture in the same space, using 85 to 90% less water. We didn't invent it, but INMED developed a low-cost system utilizing local materials that allow for incremental growth with intensive training. Initial modules can produce enough fresh vegetables and fish to feed a family, plus surplus to sell at the local market. Subsequent modules are pure income generation. So few youth are going into farming around the world, instead migrating to cities where there are few opportunities. But this adaptive form of agriculture is inspiring the next generation of farmers. We are currently implementing the program in Jamaica and South Africa and beginning in Peru with small farmers, fisherfolk, and youth. Our program offers real hope for sustainable food production and income generation for poor communities across the globe. We'd also love to do more to address food security and obesity in the U.S., implementing school gardens and nutrition programs to train children and parents on the importance of healthy eating and physical activity.